I've been joined this morning by Dr. Clement Edusa. He's a medical oncologist and medical director at SDMC, and also Gloria Youngson. She's a cancer nurse and a director at Cancer Connect Ghana. Ladies and gentlemen, welcome. Good morning. How are we doing?
Good morning.
Number one, what is prostate cancer? We keep hearing about it. What is this monster that seems to be terrorizing men?
So prostate cancer, first of all, I think we need to understand what the prostate is and then what cancer is. Prostate is a gland which is found in men, located between the base of the penis and the bladder. And its main responsibility is to produce fluid for the semen.
Okay.
So it nourishes the semen. Cancer on its own is your own cells which have gone haywire. So they've developed a genetic defect, and now they reproduce and they cannot die. So you have this mass which grows and develops abnormally. So prostate cancer is now these cells of the prostate which now grow uncontrollably.
So that's how it comes about.
That's how
really.
it comes about, yes.
What are the symptoms we look at? For example, I come to you, Gloria. What do we look at to say somebody has prostate cancer?
Right, okay. So as doctor said, when someone has cancer in the prostate actually enlarges. And then in the prostate gland, we have the urethra.
Okay.
So that tube that carries urine from the bladder for the man to urinate. And then also it carries the sperms as well. So we have both the urinary symptoms and then what we call that which helps with the sexual function.
Okay.
So that's why we are screaming about prostate cancer, because it actually affects the
You may want to
sex
break
life
it down
of
for
men.
me, the two strands of symptoms that you talked
So
about.
with the urinary symptoms, basically if there is a pressure or there's narrowing of the urethra, then naturally urination will be difficult. So people have what we call urgency, so they need to go because they need to empty their bladder. And then we have frequency, so they go more often because when they go, they can't empty it fully. And then also they have like a weak stream as well. These symptoms can be symptoms of other prostate issues, which is in prostate cancer.
Okay.
So when you have these symptoms, we ask that you go and have yourself checked so that they can determine what it is, and then you can be treated appropriately.
Is it on the ascendancy in Ghana, this condition? Is it?
Yes, it's on the increase.
What are the shocking figures you want to share?
Well, I mean, for Ghana, I would say that out of every 100,000, you're expecting 200 men to develop it.
Wow.
And you see about 1,000 new cases of prostate cancer. Cancer on its own in Ghana is about 16,000 plus per year. So it's on the rise. Part of the reason why it's on the rise is because of the screening that we've sort of started, and
so
the
you're
world has started.
identifying-
Exactly. So you identified patients much more earlier than what happened before when they used to come in the end stages. Yeah.
Say you have a family history, your father had prostate cancer, he died. Are you at a risk of getting it?
Yes.
What's the proximity of this risk?
So your risk actually doubles with your having family this thing. Yeah. There are some kind of genes which are transferred. So BRCA1, BRCA2, HOXB13. Those are genes which gives you that high risk for developing prostate cancer.
Interesting. Let's talk about age. Who can get it?
Right, okay.
It's a 16-year-old boy.
That's also, so age is one of the risk factors. So as you grow, it typically for Africa would start from the age of 40, 45. 40, if you have a family history, then you should start thinking of checking.
Okay.
So we in Africa have, we get prostate cancer at a bit of a younger age compared to Caucasians or Asians. And also apart from age and then the family history, there's also the aspect of race. So Africans are more predisposed to this prostate cancer. So these three are the factors that we say there isn't much you can do about. But then there's dieting there or lifestyle choices, what you eat, exercising, that comes into play. So as for that lifestyle, I think it runs through everything healthcare. So basically for hypertension, diabetes and all that, exercising, eating very well, and then keeping a good weight.
Doc, you want to top up for me? And I'm asking this because Friday night you see the guys, they're drinking everything that's there to be drunk. They're chewing everything. Some are shisha in their lives.
Of course.
Do they stand at a greater risk?
Yes, you stand at a greater risk. As Gloria rightly said, diet plays a major role. So we know that you're supposed to actually cut down on the red meat you eat and fat, animal fat that you take in. And obesity is one of the greatest risks, both for prostate and even breast cancer.
Okay.
So once you're obese, you need to try and tone down.
Somebody would ask, is this sexually transmitted? Can you pick it from someone?
So there is a link between infection and cancer. Viruses play a major role in a lot of cancers. I think there is a link with sexually transmitted disease and the number of sexual partners that an individual has.
Let's look at treatment. Is it possible to treat it? Is it possible to get help for somebody who may have seen symptoms, whether urinary or other symptoms? Is there help?
Yes. So again, we drum on early detection. I think I'll pick that up, and then Dr. Edusa would continue. So early detection, because if we are able to detect it early, then treatment is more effective, and then your chances of survival is very high. Because we get about 80-90% in Europe and in the Americas, but when you come here, more people are actually dying. More than 50% of those diagnosed are actually dying because they come at a late stage. And then some of the treatments Dr. Edusa could go through with us.
Yeah, so treatments which are available in Ghana are surgery for prostate cancer, so it's a prostatectomy. We have external beam radiotherapy, brachytherapy, which is also a type of radiotherapy. And then we have biopsies, which of course you need to do before you can have any treatment. You have chemotherapy for the later stage of disease. And we also have palliative care for people who would not benefit from any treatment but still need that kind of medical care.
What about those who would opt for herbal concoctions to say, look, me nana say, what do you say to them?
It's a big problem in the medical field with herbal issues. I mean, orthodox and non-orthodox treatments sometimes flow in parallel, even though we know that medicines are taken from plant-based this thing. I've seen a lot of people who've gone through herbal treatment and actually come up very bad and come late. So I would say that in as much as people believe that this is what has been passed down from tradition and from their family, to see a doctor is also very imperative and very necessary.
What happens, Gloria, if you don't seek early treatment, you ignore the signs, and it gets worse? What options are available to you?
So the signs that we spoke about, which is the urinary, typically with prostate cancer, it's a bit silent. So you get those urinary symptoms as it's a bit, the cancer has grown a bit more, hopefully still confined to the prostate. But then again, as it advances, there are more symptoms, because what happens is with cancer, the worry is the fact that it breaks from the original sites. So if it's the prostate, through the bloodstream into other organs. So other organs for prostate would be bone, it could be the liver, it could be, and then these are major organs that serve us. And if you don't have your lung working, if you don't have your liver working, then basically you're doomed. So most people will come with pain. I think that's advanced stages, the presentation they come in. At the age of 50, 55, you know, people want to get healthy. They'll be jogging and then they hear, you know, something
and then
somewhere. They go out there, they think that, oh, it's just a normal fracture, but it could actually be prostate cancer that has moved into the bone. So those are the things. And then people would have sometimes painful ejaculation, blood in the semen. That could be advanced
Where can people go for help? Now that you have told us everything we need to know and you're scared us enough, where can people go for help, Doc?
So I work at Sweden Ghana Medical Center, which is a private cancer center found in Ghana, East Legon. Our doors are always open for patients to come and inquire and seek treatment. You can also go for help in government institution. Kolebu Teaching Hospital has a cancer specialized area. Confined Teaching Hospital also has a cancer center. So those are the three centers which you can find in Ghana.
Interesting. Gloria, your closing thoughts.
Yeah, so when you talk about screening, most urologists should be able to take care of that, to screen. So we advise that men from the age of 45, if you have a family history a bit earlier, and you should know these things. So let's have a discussion with our family to find out, and then we can actually save our lives. Cancer Connect is also available, so it's basically a cancer support network for all cancers. So we start from creating awareness, which we're doing, and then also supporting through treatment, diagnosing, navigation. And then there are other pharmaceutical companies as well, Johnson & Johnson, which is very passionate about prostate cancer, that is supporting the effort. So help is available. We just need people to come out.
You are a cancer nurse. The men say they are not comfortable coming to do the test. What do you say? You
know, it's about your life. It's about your life. And if you're not comfortable with a female nurse, you can always get there are male doctors around that you can always get. But think about your life, think about the years ahead, think about your family. Because if this cancer happens, it's not just you it affects. It affects your wife.
Right.
When you're talking about sexual issues, the wife definitely. It affects the kids because you're not well enough to go out there and work and then support your family. It affects the extended family. And I'll add as well, it actually affects the government because you're not able to be productive enough for the country to thrive. So it affects everybody. And we want you healthy. So that is why we're taking this June to celebrate and honor men and then talk about your health issues.
Okay, Father's Day is on Sunday. They have not wished us, but we're okay. Doc, thank you very much. Dr. Clement Edusah is the head, is the medical oncologist and medical director at the Sweden Hospital here in Accra. And Gloria Youngson is a cancer nurse. She's also a director at the Cancer Connect Ghana. Thank you very much for your time, and God bless you for your good work.
Thanks for watching. If you have learned something, please subscribe to our channel and turn on the notification bell and give it a thumbs up, and don't forget to leave a comment in the comment section below to be the first to get subsequent releases through our channel. And if you're on phone or on tablet, don't forget to like and subscribe and turn on the notification bell as well, and help us share with your friends and family. We love you. Home Kiosk TV.